Now let us look at the specific management. And here we are going to depend on the gestation age as per Essential and Newborn Care Guidelines 2022. So, before 36 weeks of gestation, and this mother presents with mild anemia, that is an HB of 8 to 10 grams per deciliter, we are saying after the above checking, a good response, that is hemoglobin by 1 gram, should be observed in 2 weeks. So this mother is having mild anemia. We are going to give ferrous sulfate and FeFo. We expect that after the mother has dewormed, we have prevented bleeding by hemolysis. This mother, we have no malaria, and the HB is between 8 to 10. We are going to use folic acid, and then, folic and ferrous, that is FeFo, and then we are going to give the IPT, that is to prevent malaria in pregnancy. We deworm, and then we advise on diet. So we expect that the HB will rise by 1 gram. So it means that from the spot check, and if this mother is compliant with all what we have talked about, the HB will rise between 1 gram, and this should be observed within 2 weeks. So this mother should come back for assessment within 2 weeks. And if it is still 9.9, please refer to a higher health center. Don't stay with this mother in the maternity center. And if this mother is having moderate anemia before 36 weeks, that is 7 to 7.9, and is still in the first or second trimester, so do the same as above. Give folic FeFo, give IPT, deworm, advise on nutrition, and then check the HB after 4 weeks. The other one we checked after 2 weeks. And rule out what we call non-compliance of the oral therapy. Non-compliance means that you have given FeFo, but the mother is not taking it. We might think that the mother is not improving, but the mother is also not taking the drugs. So let us use our counseling techniques, communication techniques, and find out whether this mother is compliant on oral therapy. And if the HB has not increased by 1 gram, give parental interferon according to the hemoglobin deficit, and also continue with basic treatment and antenatal care. But if this mother is having severe anemia, we are going to transfer this mother to a CMOC, that is a comprehensive obstetric care facility, at any stage of pregnancy. Even if it's first trimester, second trimester, we refer this mother to a bigger health facility. And we are going to do all the investigations, and then the interferon will be calculated according to body weight and HB deficit, and they should be given by injection. And HB should be checked after 2 weeks, and we should continue with the basic treatment and antenatal care. But if this mother appears after 36 weeks of gestation with mild anemia, that is an HB of 8 to 10.9 grams per deciliter, after the above treatment check, a good response of HB should be observed within 2 weeks. Here I mean that after 36 weeks of gestation, mother mild anemia, do the above general interventions of managing anemia. And then this mother should be given a return date after 2 weeks. And after 2 weeks, we expect that the HB should have increased by 1 gram per deciliter. But if it is still 10.9, that means that it is still mild. Refer this mother to hospital for further investigations, and also talk about the delivery plan where this mother is going to deliver, because soon this mother is delivering, and not this mother is prone to PPH. Then modulate anemia after 36 weeks of gestation. Do as above. And if the mother is not improving after 2 weeks, we are going to give interferon and continue with iron and folic acid, diet, antenatal supervision. If HB has not increased, refer to hospital or health center for more investigations, and arrange for delivery at a facility which can provide emergency obstetric care. And if the mother is having severe anemia, that is HB less than 7, please refer this mother quickly to a bigger health facility. This mother may need blood transfusion, and it should raise the HB to 10 grams per deciliter. And refer to hospital for comprehensive obstetric care immediately at any stage. Note: counsel women to continue their iron tablets even after delivery for more than 2 months to treat anemia during breastfeeding period. All women should take iron tablets with meals, but not with coffee or tea. So what does it mean? They should not prepare coffee and then take it with the ferrous or tea. They should take the iron tablets with a meal. Okay, so in prevention, we shall talk about a few preventive measures. One is iron and folate supplementation, which is very available in the foods the mothers eat, or even in the drugs we give these mothers. So they continue with iron and folate supplementation. We talk about the diet, which is rich in iron, and both from animal sources, red meat, plant sources like vegetables, folate, etc. Animal products like meat and eggs, and dairy. So here we also advise the husbands to buy these things for these women because they are very essential for blood building. Then in verge of prevention, we also screen and early detect. So what does it mean? If we screen out this mother early when he's still having mild anemia, this mother is quickly managed and can improve. But when we delay to screen and this mother comes in severe anemia, the management of this mother may be complicated. So treatment of underlying infections such as malaria and hookworm through prophylaxis treatment, environmental interventions like using insecticide-treated bed nets can reduce anemia due to parasitic blood loss. Education and awareness is also very key. Let us continually talk to the community, to the mothers, to the families about prevention of anemia through the above interventions: eating well, attending antenatal, compliance with drugs, deworming, sleeping under treated mosquito nets. All these, let us always have the community, the parents, the families know about the prevention of anemia, plus the risks of anemia in pregnancy. Okay, so with we shall just have a few nursing diagnoses as diploma students. So as we nurse a mother with anemia, these are the possible nursing diagnoses. This mother may be fatigued, related to decreased oxygen carrying capacity of the blood, evidenced by frequent complaints of tiredness and reduced activity tolerance. Imbalanced nutrition, less than body requirements, less than, related to insufficient iron intake and folic intake, evidenced by low hemoglobin levels, poor dietary intake, weight loss, inadequate weight gain. All these are signs related to imbalanced nutrition, less than body requirements. Then activity intolerance, related to decreased hemoglobin, risk for fetal injury, related to maternal anemia. So this mother is at risk of intrauterine growth retardation. Then ineffective tissue perfusion, related to hemoglobin concentration, impaired gas exchange, related to decreased red blood cells, and anxiety related concerns, etc. So with these few remarks, I'm going to request you to attempt these few questions below. Thank you.